It's day 3 at the International Conference on Dengue and Dengue Hemorrhagic Fever here in Bangkok, where I'm in conversation with Dr. Stephen Moulton. Dr. Moulton is from the Department of Surgery at the University of Colorado and the CMO of Flashback Technologies. Dr. Moulton, welcome.
Thank you. It's nice to be here.
Your talk was on non-invasive methods for fluid resuscitation monitoring in dengue hemorrhagic fever. Could you just elaborate a bit for me?
Sure. So we've been working for the past 5 years developing non-invasive monitoring technology for detecting blood loss and hemorrhagic shock on the battlefield. This work has been funded by the U.S. Army, and we've done some recent work in the field of dengue using our technology to now detect volume loss and blood loss in children with dengue hemorrhagic fever.
And what's the technology that you employ?
So we used computational technology, state-of-the-art machine learning and feature extraction techniques. We applied these to a human model of blood loss at the U.S. Army Institute of Surgical Research in San Antonio. And to cut to the chase, we've basically developed a technology that allows us to extract features from the non-invasive waveform data that are indicative of how far or near a subject is from hemodynamic decompensation. So this is a prototype device. We call it CypherOx. It's a non-impulse oximeter. It's also got a small processor, memory, battery, and a Bluetooth radio. And the device is using pulse oximetry to analyze my pulse ox waveform, and then built into the device is what we call the CRI, or Compensatory Reserve Index algorithm, which is analyzing every beat of my heart, and it's telling me how well I'm compensating for volume loss. In this case, my CRI is quite high. It means I'm well hydrated, but if I were to take a few big breaths, my CRI would go up because I would increase the venous return to my heart. If I were to get up and start walking around, it would decrease because the blood would be pooling down into my lower extremities, my legs, and the CRI would go down.
And how does this translate into very simple terms in terms of people that are infected with dengue?
So, as you know, with dengue, patients can have asymptomatic disease, they can have mild disease, or they can have severe disease. In the setting of severe disease, there's significant central volume loss, and one needs to replenish that volume, but not too quickly, otherwise the patient will become fluid overloaded. So in this case, we can not only diagnose and potentially triage patients into not so sick and sick categories, but more significantly be able to trend their volume resuscitation to optimize their therapy.
You mentioned that this started with the US Army, and it's sort of been transferred or translated, the knowledge that you've picked up, from the battlefield to the hospital. Could you talk more about the Army's role and how that process worked?
Sure. So Victor Convertino is a PhD researcher at the US Army Institute of Surgical Research, and he's been working for about 10 years trying to develop a model for significant human hemorrhage. About 5 or 6 years ago, we brought new technology to analyze the waveform data that he was collecting at the Institute of Surgical Research, and basically this technology has allowed us to peer into the waveform data that he's collected and to find features that are indicative of central volume loss.
And just finally, what are the biggest challenges you face, both technologically and in your studies?
So this is, in a way, it's an existing technology because we're analyzing the pulse ox waveforms. However, we're doing it in a new way, and this is creating some challenges for us as we strategize our approach to the Food and Drug Administration to get this approved for patient use.
And ultimately, one hopes that it will benefit.
Absolutely. It could not only potentially optimize care for the dengue-infected patients, but it could also make their care less costly and overall improve the outcomes.
Well, good luck with it. Dr. Moulton, thank you very much for joining us.
Thank you.